I'm Dr. Shashikant. I completed my MBBS. MBBS means it's a modern medical graduation, followed by MD in Yoga and Rehabilitation, plus MD MSc in Applied Psychology. So I started my institution back in India. So when we met Mani sir, and we just discussed how yoga therapy can be implemented from the very back from India to here in Malaysia. So it's a very new concept we are trying to apply or trying to convince or trying to give it in a clinically evident manner to the people. So this is you are the platform people who are listening to this for the first time in entire Malaysia, because up till now yoga as a therapy is not much being taught, and when now it's being medical graduation people or yoga masters are being involved together in one particular platform, that I can very surely tell that within 1 year or so we'll be starting our dream International Yoga University run by our master Mani sir. So for that it's a kind of initiation. So we are the part of it. I'm very happy. Start the class. Let me explain this better. See, all of us, we are very fond of, or we know how we are doing yoga asana, physical postures of yoga. Yes or no? Before that, very small introduction of all of you, your name and your background, profession, what you are doing, so that it will be easy for me to take examples of, say, for somebody in banking, somebody in professional. I can take few examples and I can give. Start with your name and your education.
I've been practicing yoga for 2 years.
Profession. Yoga is a profession.
No.
What's your profession? Profession.
Student.
Hi, my name is Yeshi. I started the yoga instructor course end of last year.
No.
I'm not working at the moment, but I used to work as in the office and I review songs.
Good.
My name is Lani.
General manager smart.
I'm the sales executive smart program.
Maria and Husband taking yoga instructor course.
Housewife is a very big job.
I'm Lily. I'm practicing yoga for about 3 years.
This background.
My background is in IT.
Good.
Hi, I'm Nesmita. I'm in the banking line. So I've been practicing yoga for the past 1 year.
Your picture is on smart.
Yeah. I'm Sujata. I'm housewife. I'm part-time yoga instructor.
I'm Melanie, in the banking line.
I'm Melanie, I'm graphic designer. I'm practicing yoga for 1 year.
Right?
I'm MK. I have been practicing yoga for 7 years.
7 years.
Yes, and with the oil and gas project.
My name is Kim.
Automotive.
Automatic.
My name is Annie. I practice yoga about 3 years.
Okay.
Working as a service person.
All the yoga instructors or yoga learners who are practicing more than 3 years, 2 years, please make sure that let us give very critical comment of whatever I say. Should be very, very critical. Why you are saying this, something like that. All the IT people or banking people or professional people, just make sure that during the class, if I ask some questions next, what are all problems in that particular field, you make sure that you will ask. Say for example in IT, people sitting in front of a computer for more than 6 hours or 8 hours, they'll have Apple tower syndrome. They'll have excessive burning sensation of eyes, something like that. This examples I'm giving. Shut our class. Before going for slides, and let me use this platform. What we are practicing in ancient Indian texts, this one I'm going it as a evidence based, where the text has been given. Yoga Vasishtha is one text which gives existence of 5 different bodies in one particular individual.
What is it? Ancient?
Ancient Yoga Vasishtha. Y-O-G-A-V-A-S-H-I-S-T-H-A. Yoga Vasishtha says there is the existence of 5 different sheaths or bodies in an individual. please comprehend this one with your intellectual ability. First body is in Sanskrit name Annamaya. Annamaya Kosha is. It exactly means physical body. Physical body, imagine. Physical body. What else you can have? Just physical body plus Pranamaya Kosha. Prana is vital energy. Vital energy field. So that's one sheet. They'll consider that one as a one different body. Body means not exactly physical body, but in the entire framework of an individual, there are 5 different existence. Physical body, vital body, emotional or mental body, intellectual body, and bliss body. Can you logically agree this? You can? There is a physical body, there should be something inside to function. Otherwise it's as simple as dead body. No? There's something is required to function. That's a vital energy. Your heart is pumping, your food is being digested, your vision, your brain cells are working, all those. It's a vital energy. So that's equal for all. No? We are going for that concept. Yoga, usually most of the time they consider it's a segregated portion of a religious practice. It's exactly not. So that's why this is a big platform wherein every individual has this. No? Every individual have a body, every individual have a vital energy. If we have body and vital energy, what else we need to have? Emotions to respond to your family, to your friends, to your social environment, to your public. There should be some emotion to comprehend and respond. So that's the emotional body. To analyze and work on. See, we are saying bank people. You are in a computer IT person, you are a housewife. You need to do something intellectually every day, apart from physical, your vital energy and emotional. You are doing something very intellectual. Now you are all sitting and you are listening. That's the intellectual analysis already going on. So that's another sheet, another part of existence, the intellectual body. So everybody wants one thing in their life and want to avoid another thing in life. What might be that? Everybody wants, everything what we do is just for one thing. Peace. In Sanskrit there is a saying that Sukha Prapti Dukkha Nivritti. Everybody wants happiness. Everybody wants to be devoid of misery. Yes or no? Whatever we do. Whatever. So that's very general category. So a bliss, silence or happiness, that's another state of existence. Few of us we have seen thriving for peace of mind, thriving for happiness. They'll be having everything. Physical body, emotional body, vital energy, everything is there. Intellectually they are very sharp, but still not happy. Have you seen? In our smart program we see few of the people. So this is a logical conclusion that there can be existence of 5 different sheets, 5 different bodies.
Can I ask questions along the way?
Along the way, if you want to ask, if you want to sit for a long time, I don't know. No, I can.
Should I wait until the end to ask questions or can I ask?
Then you may not remember, you can ask now.
Okay, I just want to know whether this layers that you talk about, so do they, are they separate layers?
It's not separate.
They all...
It's not a very watertight compartment. It's all interlinked.
But the only difference is whether you are balanced, whether you have more of this and less of that.
Yeah.
That's the difference.
Yeah, that's how I draw this. There are 2 different representations of the same concept of 5 different sheets. This is inside out. This is outside in. Say this one, gross physical body outside. Inside the physical body is a vital energy that we can comprehend. Heart is beating, your breathing, your brain cells are working, your food is being digested, there is a blood circulation. Vital energy inside. Then emotions inside. Then your intellectual body inside. Then your bliss body inside. So this is the actual representation of 5 different sheets. I will not say right or wrong, but this is the most preferred. So most other Indian way, when you go back to India somewhere, they represent this way. It's because it's an expansion. Gross physical body, this is small compared to your vital body. In that way they expand. So this representation doesn't mean it's all watertight compartment. our intellectual field may be very big. In one particular field, yes, definitely yes. In your IT field, your intellectual level is big compared to all of us. In the banking field, your intellectual ability is totally different. In that particular aspect is different compared to all of us. Yes, sir. So that's one way, another way of representation. This is most preferred. We can understand. This is based on expansion of that particular sheath or layer. Very good question. It's not a watertight compartment. I'd like to take this one.
What is the bliss body?
Huh?
What is the bliss body?
This body is a happiness state. When we talk about the science, now we are coming to therapy. How can we apply this particular concept of 5 different sheaths and into therapy? Most of the modern medical science says they only concentrate on physical body. Most of the time, physical body they concentrate. Physical body in terms of flesh, your muscles, bones, tendons, ligaments, nerves, blood vessels, that too, arterial blood vessels, venous blood vessels, and lymph nodes, all those things. And then categorized into different cells, smooth muscle cells, interstitial muscle cells, skeletal muscle cells, and heart muscle, something like that. This is aggregation. If you go to a doctor, there might be some infection. I'll take an example. How many of you will have on and off gastritis? I do have. Okay, 4 or 5. So this is because another question. How many of you have on and off back pain? So this is how science statistics says. More than 70% of the people, normal people, will have back pain one or other time within a period of 10 days. So most of us have raised hand because I know at the back which is the most common disease. We'll take example of gastritis. If there is a gastritis, what doctor will do? What modern medical doctor will do? Prescribe. Which medicine? You know that medicine also. Antacids. Gastritis, more acid, antacid. Yes. Very simple, no? Treatment. More hydrochloric acid. You are cutting it with the antacids as a treatment. Okay, this is a routine which is going on until now. Now there is a science wherein you are trying to go to the root cause. Why this gastritis? Why there is a more hydrochloric acid? Okay. There are different stressors. Can you name the stressors? Housewife working at home, getting children ready to send to school, that is also a stress. Different stresses, financial stress, job stress, career stress, workplace, everything. It increases your sympathetic tone. Have you heard of adrenaline rush? Most common corporate word, adrenaline rush. Adrenaline is a stress hormone which increases during the stresses. Then it induces increased gastrin. So one particular, I am little technical in this, but don't mind. Even if you don't remember any of these words, don't mind. There is more stresses. It stimulates sympathetic nervous system that we are going to study what it is, and it again increases gastrin. Gastrin is the one hormone which directly increases hydrochloric acid. So you know where we need to approach stress. When you cut down this one, when you reduce the sympathetic tone, when you reduce the gastrin, no doubt hydrochloric acid will reduce. There is no point in treating antacid for about 3 months, 4 months, 5 months. They say, doctor will say, this is antacid. When patients are so intelligent enough, doctor, I have acidity. Please prescribe me some antacids. Because without prescription, you will not get medicines. And internet is a one big thing. Worldwide web, mad web. Any information you get, all the details will have. Sir, I have a neck pain. I don't know, is it stiffness or is it a sprain, is it a spondylosis? You'll say all the differential diagnosis. doctor will say, okay, you know already, you go get this blood test done, get this X-ray, get this MRI done. Okay, all the things will say. Even a lab technician can also say that, oh, you have cervical spondylosis, take. Go for some physiotherapy, do some exercise, 1, 2, 3, 4, finish. So that's how it has been. Technically, it has become worse and very wide. Super specialties, we have a difficulty. There is a gastritis. Gastritis induces headache. Yes or no? So if you go to a doctor, he will say gastroenterologist, you have to go and visit first. Oh, you have headache, please go and visit neurologist. Then you come back and visit orthopedic doctor if you have some low back pain or something. So that concept we are trying to cut down, even at a corporate level. Cost, health cost, what the company pays, employer pays is tremendous. If you are intervening somewhere here, then you are reducing number of these symptoms. We are avoiding this particular treatment altogether and going to the core of a treatment, sympathetic tone. One more research says most of 70% of primary physicians visits are one or other way related to stress. How much? 70% when you go to a family doctor, you visit no first time. If I have some symptoms, I will go and visit a family doctor. More than 70% of causes are one or other way related to stress. I think one of you have that lady sitting with the stress. You can see this one later. It shows different systems how they are involved. So now I came to the modern medical science, mainly physical body. For that to say, I explain all this. Then vital body, not much. We don't concentrate much on vital body. Modern medical science, not much at all. So only maybe during post cardiac surgery they give you some breathing machine, spirometer, to increase your lung volume, more or less. Or they use physiotherapy instruments, tense instruments to stimulate your nerve endings to reduce back pain or anything. Tense, you know, trans-electrical cutaneous nerve stimulation. This one instrument, small instrument, they will connect the electrodes to your back. Or any health slimming institution when you go, they will use multiple muscle vibrators. They will apply to you. You lie down, you watch TV in front of. It will be moving, all the muscles will go. So vibration medicine says any body put it in vibration, it will tend to reduce calories. So it will reduce weight, but at the cost of what? Modern medicine may concentrate mainly on physical body. So for the past 200 years, most of the doctors never used to believe existence of psychological and psychiatric diseases. Very recently, 200 years, recently, people started believing that there can be diseases of mind and body intervention. So I explained about gastrin and hydrochloric acid. There are few problems which are related to hormones like dopamine, serotonin, and others. In a stress, in a mania, in a bipolar disorder, in a obsessive compulsive disorder, in a schizophrenia, so many disorders, these hormones tend to be a part of it. It's a multifactorial. Maybe your genetic tendency to that particular disease, yes. Maybe you're brought up, yes. Maybe your childhood traumas, yes. Something. It's all conglomeration. Different factors are contributing for that particular disease. So there is the existence of psychology. So this is body. Can you see? Medicine is different, only physical body. Mental body, psychology, psychiatry, psychotherapy, hypnotherapy, biorhythms, tai chi. It's all mental. Yoga. It's all mind-body correlation. Vijnana mind question. Increasing your intellectual capacity. Say for example a diabetic person. How many of you are diabetic in your not diabetic? Intellectual ability. Eating potatoes will increase blood sugar. This is knowledge. But a person will be there who controls everything, but his only habit is eating chips. So indirectly he doesn't know it, but eating starchy food can increase blood sugar also. He doesn't know. If he knows, he can control. That's the intellectual correction. You know? Awareness of that particular disease, awareness towards yoga. Now I'm coming to that point. Awareness towards yoga. You're doing some exercise, some asana. Shall we do or no? Keep your both hands in front like that. finish my talk, we will be rotating your hands. So it will ward off. This is again psychologically, so almost 10 minutes done, 15 minutes done. This is your attention span is starting to reduce. So I am interrupting in that point. So move. Keep moving. So it's the intelligence of the person. Okay, I will keep talking. Intellectual level, so correction at the intellectual level. Now you be intellectually analyzing that which parts of muscles you are moving. See, which parts of muscles are moving. How is your spine? Which parts of muscles you are moving? Upper arm. Can you specify? Shoulder. Can you specify? 7 years of yoga. That's how it counts. That's how it counts. Okay, at last everybody has the right to be happy. That level. Most of the practices which increases happiness. Anything again, Tai Chi, biorhythms, autogenic training. You stop it. No, never participate. Okay, stop that. Slowly release. Slowly release. Today night we will have a game. Where? Specifically deltoid. This is the deltoid muscles. Can we be this specific after learning yoga at least for 1 year? Can we be this specific? Or we should be, or we should not be? Because yoga teaches everywhere we go, we tend to have a humiliation that this is a real fact and it's not again research humiliation that it's a kind of religious practice. Yes, no doubt yoga is a system devised by, accidentally discovered by so-called Hindus, and it's not their right to grab to that. And others, why can't others get benefited out of it? You know, it's a science, pure science. Am I explaining all the things into science or religion? Science, it's total science. So all these 5 aspects of the existence yoga touches. Believe it or not. Physical level, yoga, asana, kriyas, diet modification. I am combining here modern medicine, psychology, mind-body medicines, other hypnotherapy and other things, yoga, your modern medical treatment. I can include modern medicine here, treatment, physical body, yes, yoga, asana. Say for example diabetes, I am giving a tablet, plus special techniques devised from yoga which may affect in controlling your blood sugar. Yoga, kriyas will help to cleanse your body and reduce the blood sugar. Diet modification, diabetic diet, hypertensive diet which is less of salt, less than 2 grams per day. Lipid, high cholesterol diet. Can you see the combination now? Can you see the combination? Modern medicine, yoga, asanas, kriyas, diet modification. So that's at the physical level. Okay. Second, coming to which is the second body? Prana. No. Which is second body? Vital body. Vital body where, see if somebody dies, what do you say? He left. Who left? Who left? The prana, what do you say? Prana, chi, zi. You know, Chinese people they say chi is energy. Zi, Japanese, they say it's energy. That particular vital energy is lost through the route of respiratory system. I mean, that's why they say Mahaprana. You have learned this? Why can't? Yoga therapy. Yoga students, they should know this. The drawings are very worst. Upward forces are called as Udana. Downward forces are called as Apana. Balancing forces are called as Samana. I'll explain. Respiration is called as Mahaprana. These are all just words, Sanskrit words that originally described through text and what it means for us. That's all. Then throughout the body, Vyana. Apana, downward forces. Which are all those? There are forces of our body which are downward. Urination, defecation, procreation. Yes or no? Downward forces. Upward forces. Sneezing, coughing, yeah, spitting, talking. All this upward force. There is a force or no? There is a force. Even if you metaphysics, physics, if you compare, there is a force who will call it is producing sound. That particular sound is reaching to you, your ear, through the medium of air. That's why. So, Udan upward force, downward force. Just imagine upward force, which are all upward forces. Sneezing, spitting, coughing, talking, all this upward force. Vomiting, Kriya again comes there. Ujjal, putting upward force, you are stimulating upward energy, downward energy. You are trying to control this Mooladhara, Ashwini Mudra. You are trying to work on Kundalini things. Samana is a which balance, dominant, digestion and balance, Samana. Mahaprana is a respiration. Maha means higher. So they have given a lot of importance for respiration because it's a one which goes last. When there is a brain dead, if your respiration is on, you are still alive. You know what it means? Then Vyana, body sensations. Throughout the body we have different body sensations. That's a Vyana. Okay, now we are concentrating on just Mahaprana. Don't mind that class is too much for you, but it's a comprehensive of all. Most of us may not understand what we are learning, but at the same time, some point of time when you are actually studying, you will understand. So I am coming to this Mahaprana, Pranayama. When you are doing Pranayama, you are regulating that particular larger prana energy, Mahaprana. You are regulating. We'll do a small experiment. Can you check the time? 30 seconds. We are going to hold our breath for 30 seconds. Then we sit comfortably. Close your eyes. Back, neck, head in a straight line. 30 seconds.
Now.
Hold your breath for at least 30 seconds or till I say breathe. This is the order, huh? Please. Strict order, federal law of Malaysia saying hold your breath for about 30 seconds and enjoy also. One more indirect suggestion for you. Time starts now. What happened?
We started already.
How many we could hold for long? The maximum may be 30 seconds. If your lung volume is more, if you are breathing for a quite long time, and other things, maybe 45 seconds. May not be more than 1 minute. Yes, sir. So that only that portion is your voluntary nervous system control. Voluntarily you are trying to control the respiration only to that extent only. Respiration is the only energy thing in our body which we can control partially. Rest of the time it's autonomic. Autonomic means involuntary. There are two systems, voluntary. Come here. Voluntary. He is receiving signals through his ears, and brain is voluntarily commanding them, is requesting him to get up. Use all skeletal muscles, bones, tendons, get up. Again, brain is guiding him to walk forward. It's a cognitive information input, and he is responding to that. It's voluntary. Can we control our heart rate? Can we? Can we? No. Only if you advanced yogis can. Cannot. Usually we cannot. Normal people, not yoga people who are practicing for several years. Normal people cannot. Yes or no? Can we control our digestion? Can we control our defecation, excretion? Yes, we can for some time. Sometime. Can we hold our bladder, full bladder for some more time? Yes, we can. That's a voluntary control. Beyond that, even if there is very nice class, go ahead and go to washroom. So that is voluntary control is one. Involuntary control is optimum. Body knows how to function very well. We don't know this function, but our body knows. There is inbuilt. There is energy which knows how to function. So prana, I am again coming. It has voluntary and involuntary functions both. Voluntarily you can regulate prana, ayama. You are regulating your breath by external modification, either using your nostril breathing or using kapalabhati or ujjayi. All the practices you are trying to regulate and increase lung volume. In pure science, increased lung volume, increased availability of oxygen, increased metabolic activity, refreshment. That's why people who are doing yoga, real sincere yoga, following all the yama, they can go to any extreme. They can be in Himalaya with very less clothes, still maintain their body regulation, temperature. Especially one research conducted in, I'll share that. Too much talking. Pranayama. So that has that particular potential of treatment increase. Can we control anger through this pranayama? We can. So corporate techniques, using this breath as a tool, you can work on anger management, apprehension, and all those. Emotional strengthening, emotional intelligence. So yoga also says a discipline. Anybody who can do yoga asana in a gymnastic way, very flexible, is not yoga at all. It's just physical posture, you're touching one aspect of that physical posture, that's all. You're doing perfect yoga, at the same time you're not able to control your mind, no use. So there are yoga discipline, full yoga discipline says there is a strengthening of your mind also. In all the religions of the world, they use beats. They use beats, chant. These beats. In all the religions, they use something like this to chant. Christians, Hindus, Buddhist monks, Islam also. There is a white color Islam. During namaz, after the namaz, during the reading the Quran, they'll do the chanting. Why? Why they might have suggested that? Religion in touch, in tune with science. How?
Develop concentration. Develop concentration.
Yes. How? So weights are the one which touches your subtle points in the form of varma. You can call it as mudras. You hold mudra. Why you hold mudra? How? Any medical research? All the beats they say number of receptors in your hands are maximum. Anywhere, any medical graduate you can ask. Number of receptors in your hands are maximum. That to thumb is the highest number of receptors. Receptors are different varieties: soft touch, gentle touch, hard touch, pressure, pain, heat and cold, all this vibration. I want you to close your eyes and move your finger up, but you still with your closed eyes you can sense your joint position, yes or no? That is a vibration sense. There are specific receptors which will tend to send signals of your body. If you are leaning towards right, closing your eyes, still you know what you are doing without you being aware of what you are doing. You are looking at it. So there are groups of receptors which does this function. So hands contains maximum number of receptors. Thumb is the maximum. So most of the religious people they use thumb. So it's somewhere subtle energy or somewhere subtle knowledge there might be existing. How they might have propagated that particular teaching for the common people. You do this chanting 100 times. Any chanting, any religious practice, not pertaining to one. Just practice. for common people to get the benefit of that particular stimulation of those nerve sensory endings, at least for some time. So there can be activation of reflexology, there can be activation of chi energy, there can be activation combination of yin yang, there can be enhanced practices of what you say, vital energy enhancement, prana enhancement, or at the same time meridian stimulation. How many of you know acupressure? Acupressure, some of the points will test, and there is a meridian. Acupressure, be happy that acupressure and acupuncture has been validated by World Health Organization as a separate, effective, evidence-based, alternative medical science. It means that most of few of Chinese hospitals have seen through, I have not visited anywhere, but I have seen through my research work, saying that during anesthesia they use acupuncture to reduce the medication dosage of anesthesia. It's good or no? Very good. They are combining best of science which is available for them and best of modern medicine. Fourth layer, jnana. Increasing your knowledge about the disease, about the yoga or whatever, you can implement far better. Say for example, any difficult asana, can you do? One person demonstrating some difficult asana. Some difficult asana, can you? No. You want me to demonstrate? I'll demonstrate one asana. What the? It's only during the competition. Okay, you see, knowledge-wise, how it can be, how it is now. You will all the 4 years, 6 years, 3 years people, let me know which is this asana. What is this asana? Extended? Extended? How long I should be like this? Extended? Which is this asana? Okay, so which one is this one? Extended side angle pose. Is it? Theta Parshvakonasana. No one. Okay, extended side angle pose. Is it the same? 7 years of yoga. Yoga cannot be completed even if your life completes, because there are 84 lakhs of asanas. Nobody knows which is the asana. Indian government, after being what do you say, now it's opening its eyes that all people are making their own separate asanas, and they are patenting the asanas. This extended side angle. I'll use something like this. I'll name one thing. I'll patent. So now it's Indian government awake. It's woke up now. Indian government has identified around 1,350 asanas and it's patenting, regulating under Indian Patanjali or whatever act. Now it's opening its eyes. Till now it's ignorance. I don't know. Out of that, most commonly practiced asanas are only 99. Out of that, any schools, there are different schools. Swami Shivananda Yoga Foundation, Shivananda Yoga, you might have heard. They only practice 40. Hot yoga, Bharat Thakur, you heard of hot yoga, power yoga, vinyasa yoga, flow, vinyasa flow yoga, Just check in internet. This only uses 26 asanas. That's all. That's all. You're only using 26 asanas and you are so much famous. Vinyasa yoga is very famous. Gauri yoga is very famous. Yes or no? Okay. Too much talks. Again. I'll not do asana again. I'll draw some. Okay. If somebody can learn or teach asanas like this is one asana wherein there is a tricep muscles. You can see that. See this now? Just go through this once. All of you. Remember tricep muscle. Internal oblique. Gluteus. Maximus. Hamstrings. Gastrocnemius, quadriceps, external oblique. If we can know the perfect anatomy, it's not anatomy, learning anatomy like a medical doctor. I'm not talking about that. Just at least names of the muscles. Names of all the muscles. Because there is a difference between yoga therapists, fitness instructors, they might be knowing some of the names. Fitness instructors. It's like physiotherapists, they will be knowing little more. My request now is yoga students have to learn at least naming of the muscles. How many groups of muscles? Superficial or deep? Now what you work is for trapezius, this one you are working, and your hand muscles. Okay. If you can learn something like this, these are pure science. Then combine this with any fitness expert can learn, any physiotherapist can learn. Physiotherapists and doctors have advantage, they know all the anatomy. If they come into yoga, then for common people like us it's difficult. Physiotherapists are authorized to practice anything, any exercise. They can take this yoga. So yoga students will be left behind. Any people will be left behind because of lack of this understanding. How many muscles are there? Honestly, there are around 650 muscles. Skeletal muscles are around 206 bones. Can you at least remember these many names? Remembering, okay, can you identify? So many bones here. So humerus, ulna, radius, carpal bones, tarsal bones, ankle bone, tibia, fibula, patella, femur, hip joint. In hip joint there are 3. This is ischium. Vertebral column there are 7. Cervical, thoracic, lumbar, sacral, scapula. I'll teach one exercise which only concentrates on these groups of muscles. Usually we don't concentrate this. We'll do that. See, you can do it. Actually they say you should not do, because he is the one who is teaching. In our medical science we used to use dead bodies, what is it? Actual. Most of us, they used to joke, what this fellow standing here like this. But it's the greatness of that particular skeleton. Even being dead is teaching. Great, no? Being dead is teaching. So, facial, few beauty people. To enhance the facial beauty, there are few specific techniques. There are 36 groups of muscles which use for smiling.
36.
Yeah, I have to find out 36. I will be saying here 36. You have to find out is it true or not. If it is not true, let me know. So anything which said, don't take it word. Maybe wrong, maybe right. So don't believe anybody till you convince yourself. Okay. Now this is a new concept which we will be starting soon here in Malaysian Yoga Society first time. So learning yoga in this particular pattern. Like it or not? Like it or not? If you tell this thing to anybody, any physiotherapist, oh, you know all the muscles. This is a tricep muscle. This we call love angle. External oblique, internal oblique muscles. Yeah, this is gluteus muscles. This is a hamstring muscles at the back of your knee. I'll teach you few hamstring stretches now. This is quadriceps. This is gastrocnemius. It's a fan-shaped muscle at the back of your knee. It comes down and it will become Achilles tendon. It's tendon. Achilles. Remember Achilles? It's a gastrocnemius. Under that there is another muscle, soleus. If you can teach anybody like that, so all people will be behind you. Any physiotherapist, any therapeutic exercise person, any instructors, then or yoga students also be that competent. No? That competent. That will be starting it soon. I'll not take this on. And what we are talking here is still not yet finished. Last is, say it's an intellectual body. This is a feed for an intellectual body. Last is a bliss body. Everybody has the right to be happy and avoid of misery. Yoga has a techniques where you do meditation. Meditation just to achieve silence. Silence itself is a happiness. The best style of thinking is object is the source of happiness for me. If I eat some sweet, say some sweet you name, Malaysia's favorite sweet, durian. I saw yesterday some durian festival, something coming up. It's not much sweet now. Any sweet of favorite sweet of Malaysia?
Chiku.
Chiku, okay. If you eat chiku, the moment your taste bud touches the chiku, you feel, oh wow, happy. Yes? If you achieve some of the feats in your career, bank manager, cashier to bank manager, okay, what do you feel at that moment? What do you feel? There's one moment now, moment of happiness. It's just very small, very short duration of moment of happiness. That will feel very happy. Happiest moment of my life. You say moment. Happiest duration will not say. Moment of your life. If you get a new car, will you be happy or sad? Happy. Most happy. It's at that point of contact of your sensory beings with that particular object. At that point, there is a no thought state. No thought state of silence. Silence. If you are beach side and looking at the beach sunset, what do you do? You open your eyes or you close and enjoy? Even if the vision is, the view is in front of you, you tend to close your eye because you tend to go into this, go inwards. That's the same concept of yoga, go inwards, meditate, to be happy. You know? West usually tend to go out, coming in a larger scale, tend to go out, get all the things which we think it will make us happy. We get all the things. Object-oriented happiness is different. Inbuilt internal happiness is different. You got my point? I am searching for happiness outside through objects or through person or something. But happiness is there within. There's nothing but no thought state or a silent state. That itself is a happiness. That itself is a bliss. Yoga concentrates on long-term bliss, not short-term. Short-term bliss is a sensory pleasure, object-oriented happiness. Short duration, 20 seconds, 30 seconds, 1 minute, 2 minutes, done. Yoga concentrates on long-term. I want to start. Any questions till now? You wrote down 650 muscles, 206 bones. Listen, I will not take much time. We will go fast. This also includes students. For an old person, there is something dot exists. For a child, there is something which exists. For a youth, something which exists. What is that? I want 3 volunteers. 3 volunteers on the stage. 3 volunteers on the stage. Come. You stand here. Face that side. Please come. Thank you. Stand in the middle. Face the same side. One more. Please come. This one is the one person which I mentioned there, old person. For him or her, past exists, or the work done at the back exists. There is nothing much to achieve in the future. It's not life satisfied, happy, blissful. For a child, future exists. Yes or no? For a youth, the balancing point between old, between young. So this is the point, this is where most of you are now in this particular youthness. In this state we can achieve most of our life fulfilling things. For a old person, past exists. For a child, future exists. Youth is a balancing point between both these two. So who we should call as the youth? Is it a young person aging from 14 to 30 years, you want to call it as a youth, or even if it's old 90 years but youthful? The old lady doing leg split near the bus stop. Youth is the only one person who exists in present moment, that we can call it as youth. If we are in the present moment, we are youthful. If there is an old person who is in the present moment, he is still youthful. Okay. We are very young, but not in the present moment. Sometimes I used to worry about future novels. I am not youthful. Yeah? Youthfulness, you will see, very old people, still they do some of the physical activity. You feel how youthful he is, she is. So, this youthness is present moment. It's a balancing point. It's the same explanation of the 5 different sheets, 5 different bodies of existence. This is the main thing we need to concentrate. Most of diseases in the recent years are mind-body related, psychosomatic diseases. Most of them, almost around 70%. Cancers and other things, rare, but it's not exactly mind-body related. But common things like hypercholesterolemia, diabetes, constant back pain, constant migraine frequencies are increasing, hypothyroidism, asthma, modern urban respiratory diseases are increasing on the high. If you go to village side, there will not be much respiratory problem because sulfur and carbon monoxide from the traffic. So there is the existence of 2 different nervous systems which are called as sympathetic and parasympathetic. It will not take you much time. So you are very quiet now. Keep your eyes closed for 1 entire minute. Observe your breath. Try to identify your heartbeat, heart rate also. Keep your eyes closed. So it's another session wherein wherein attention span is reducing. So I am trying to alter the mind. If you have back pain or anything, you can use the wall support. Keep your eyes closed. Take a one large deep breath in. Exhale completely out. Two more. Take a deep breath in. Exhale completely. One more last. Take a deep breath in. Exhale completely. Now breathe normally and observe your breath rate, heart rate or heartbeat or any body sensation if you feel. For one entire minute, I will be quiet. Feel the soothing, gentle awareness of your breath, of your heartbeat. Be into the state of absolute silence from within. Keep your both hands on your heart. Keep your both hands like this. Is there any change? Any change? We thought of making very huge noise, but we could not. Any change? Any one of you? Good. I feel some change in her. 1, 2, maybe 3. What change? What's the difference between 30 seconds before and now? There's something now. This is the theory. This is the theory. What you experience is the practical. You'll never forget. What last time? What I used a real snake from a snake charmer. Teeth removed. The snake was there, just left in the class. Very huge noise, very huge shouts, cries. Somebody running here and there. And the snake charmer came in, spotted. Then we sat down. Feel that response, how it would be? Scared, then fear, then fight. But if you are somebody male, you try to kill it. Fight or fly, run away. In that your respiration will increase. You could notice, I could feel that. Respiration increased. You suddenly became like that. What is happening in this silence, meditative posture, relaxation? The heart rate increased, respiration increased, perspiration increased, your alertness increased. Your body has responded, your skeletal muscle contracts fast, it will be tight. Yeah? That is the nervous system which prepares you to either fight or flight through the involvement of stress hormones in the form of adrenaline and noradrenaline. This is what response you got. External disturbance or stressor. Your kidney, above the kidney there are two small glands, 3 by 10 centimeters, which are called as adrenals, which secretes stress hormones. And stress hormones will prepare for you what you underwent. This prepares you to fight or flight. After some time now, you are okay. The heart rate come down normal. That's another nervous system which brings back the normal state of resting and digesting. So one nervous system, two functions: fight or flight, first one. Second one, rest and digest. Simple, no? Another story. Most of us like a story, no? It's an old, age-old story. There's a caveman and tiger. What should be the response? We tell the story. What should be the response? Same. Either you are fighting or running away. That is the stress response. So there are two types of stresses. One is the eustress, E-U-S-T-R-E-S-S, eustress. Another one is distress. Distress. I am in distress. You say no. So eustress is the one which, at an optimal level, it will increase your adrenaline. At the same time, it will not have any undesired side effects on your body. That is a normal stress pattern, which is healthy for your body. Normal positive stress. You can call it as a positive stress. There is one more thing. If the same stress goes beyond certain point, it will become harmful for our body. Let's say how the disease can induce. If the same stress response what we have is for long term, maybe 4 years, 5 years, we will tend to end up in constant rise in blood pressure, constant rise in heart rate, constant state of anxiety. We will tend to hypertension. It's common concept, same concept, easy concept. So that's why I said sympathetic tone. I said no. So this is sympathetic tone. So olden days is this pattern, but now days are changed. Modern medical challenges, modern lifestyle challenges are getting up early, preparing children for your school, your breakfast should be ready in time, you should send your husband off, housewives off to school. Then at around 10:30, it's also same. From 10:30 to 1 o'clock is a housewife's time, specific time. When washing and cleaning, she'll finish around 11:30. So observe that consumer psychology. 11:30 to 1 o'clock, there are very specific housewife related serials in the TV. Whatever channel it is. Yes or no? I don't know Malaysian channels or, but this is the consumer psychology, common psychology. Yes or no? After that, 2 to 3, that's the time for food. Let's say most of cookery classes will be that time in a TV. So evening again, tea time, there is another 2 hours of time for a housewife. That's the time they catch TV. That's how they work on consumers. It's consumer psychology. What is this? Huh? It's a consumer psychology. I written M, that's all. You said McDonald's. Yes or no? This is consumer psychology. one challenge to any McDonald's eaters. Go to a McDonald's or a KFC or any company, ask them for nutritional list. And one hamburger, pizza, whatever it's called as, something which looks like this, burger. In 1980s, the burger size used to be 250 grams. Now it's increasing. You see combo burgers. Yes sir. Yesterday I saw Happy Meal 5.65 ringgits. Yes. There's one research conducted by one of the Hollywood actor on McDonald's, saying that he will evaluate his entire physiology first day. Nervous system, your gastrointestinal system, his stress levels, depression levels, and blood levels, and all those things. Then every day, morning breakfast is McDonald's, afternoon meals is McDonald's, evening is McDonald's, everything is McDonald's for 30 days. At the end of 30 days, there are very horrible results he underwent. His entire gastric system got imbalanced, his cholesterol levels were very high, his libido was very less, his depression levels are on high, he has got a lot of triglyceride fat in the abdomen. This research, you just check in YouTube somewhere, research done against McDonald's, scientific research done against McDonald's. If it is an actor, the acceptance will be larger. So that research has been already done. So that's a consumer psychology. McDonald's mainly concentrate on children and young adults. Nobody concentrates on the old people because no money there. Very young white Transformer toys are available in McDonald's. McDonald's lunch you will get a toy. So that's one psychology where child drags entire family to the McDonald's. There's psychological forget about that. There is a no yoga as a therapy should reach to this extent. The moment you say young, you should know yoga therapy kind of. Okay, that's our idea or concept we want to build. In Himalayas, it's very difficult to reach there. No? Pepsi and Coca-Cola are already available. What might be the strategy, how they were working? But not from Himalaya that yoga techniques are not coming down. Okay. So one example of use stress, normal stress is getting married, stress. You won a lottery, some so and so. You feel that excited state. That's good for you. That's positive state. You got an increment in your job, promotion. That is a positive stress. Distress example, you can give lot money. Death of a nearest family member, loss of a job, loss of money, bankruptcy, all those things. They have a negative impact on your body. I had underwent some of the insomnia things. There are few issues which my research work was not coming up. You will not get sleep. So how? That's how mind and body is interlinked. You know. We won't go much deep into this. I'll give this slide to you later. This is the first ever research available for any of the alternative medical practitioner. It might be anything. It's from Dr. Herbert Benson of Harvard Medical Science. He has proposed the relaxation response, which is exactly opposite to what we underwent just now. A few glimpses of stress response we underwent now. It's exactly opposite to that. It says that it's one of the best research background for any of the people who are practicing yoga, Tai Chi, Qigong, Reiki, pranic healing, subtle mind-body techniques like biorhythm, hypnotherapy, autogenic training, all these things. If you say distant healing, that also may work through very indirect cosmic energy. If it is pure, it may work. It's still living. It says that there is a release of nitric oxide and few of the chemicals inside the endothelium of the blood vessels, arteries, your system. You see the artery system. No, inside the arteries there is a release of some of the good chemicals, which brings the same response, which is exactly opposite as that of fight or flight. So he has written a book. If you can purchase the book and read it, it is the relaxation response, written in around 1989. He published his research in the year of 1979. Okay. Online it is available. The relaxationresponse.org. Just check that. It is the biggest support available for us. And now we are going to very technical things. When you meditate, what will happen? So again, another research is a research database we have. Source, I am not able to read the source, but somewhere. So research says there are 4 brain waves: beta, alpha, theta, delta. Beta is a normal brain activity. Alpha is a creative brain waves. Theta is a relaxation waves. Delta is a sleep brain waves. So after the end of meditation, you can see here. I will show you this portion. Parietal lobe, frontal lobe, occipital lobe, they have mentioned before meditation. After meditation, there are some changes. It is recorded through functional magnetic resonance imaging. Functional magnetic resonance imaging is one form of MRI. You know MRI, no? All of you know MRI. Okay. And there's another myth buster. Most of the time, knowing without knowing, we tend to say we are only using 10% of our brain. Yes or no? Most of the places, most of the time, people will say, why can't we get the technique to use other remaining 90% of the brain? That's the biggest myth, which can be just disproved with magnetic resonance scanning. They'll scan entire brain activities. If you are just simply sitting, they'll be scanning. So all the parts of your brain are working because it's very, very complex. You cannot say 90% of your brain is not working. You cannot, definitely not, 100% not. There are activities where to increase your subconscious power or ability, there are few practices can be done. That's a different way of saying. But you cannot say 90% of your brain not working. That's the biggest myth. So at the end of meditation, there is a reduction of beta waves. Normal brain activities will reduce. Your alpha waves and theta waves will increase. It means that you are relaxed, very much relaxed, and that pattern of relaxation response is working for you. So that's why things will get corrected. Your migraine will reduce, your back pain will reduce, because that stress hormones are reducing. Okay. So that's how it's being worked indirectly as a therapy. We feel it, but we cannot prove it. It's a common experience. After joining for yoga, how many of you feeling better? Emotionally, physically? Most of you, yes or no? That's this particular activities are happening. We are actually relaxing. So, as I said, 70% of diseases are related to one or other way to stress. And stress we are controlling in this particular pattern. So the symptoms related to stress will reduce. Okay, this is a relaxation response and stress response comparison. So I'll give it to you. You can check it. So reaching to the core point of the central physical comfort, mind state, physical tension, thinking, mind-body communication, all these things in a right balance. This may not be perfect for all the people all the time, but right balance, trying to come near to this midpoint is what is the concept of yoga therapy, which applies at all the levels. Physical, again, it's inclusion or including all the professionals in different fields of medicine, different psychological, psychiatric, and therapeutic exercise, and people who are using mind-body metaphysicians. There is. So this is the concept. Yoga can also be applied on a broader spectrum of this, or it will be a part of an inclusive of all the metaphysical practices. Again, coming back to that. So this one response, you can see how exactly stress can induce diseases. Just you can go through. If you want me to explain, I can. But I feel some changes in facial expression that it's almost done. Now, I just give this slide to you. There are not many hormone changes, angiotensin, aldosterone, inflammatory cytokines, hormone suppression, insulin also reduces. When insulin reduces, blood sugar increases. Insulin is the one which opens the gate and sends glucose in the cell to function for its metabolic system. That's how it will lead to this is if it's more blood sugar for a long time, it will end up in diabetes. This one I think only for the students. Okay. There's one research conducted on 30 students for 3 months using AUM. It's a new concept which we are using 5 different resonating sounds. Om is a resonant sound, which most of the Hindus they believe that is a god, but that makes other people believe that this is a religious practice. This is the one where we come. It's a segregation point where Om is a religious practice. It looks like that, but there is one more research. What we are doing now is already done research which says 3 months of practice of Omkara which increases your brain assimilation. All the information now you are having in your brain, the moment you go out, it will go. Because it's in temporary memory. When you reprocess, when you think it, when you see the slide back, then it will go to permanent. Okay. So temporary memory, rearrangement, permanent memory. Sleep is the biggest healer for all of us. Every day we get lots of information, all the sensory inputs, but at sleep, all the things will get vanished and very few things will remain. Like what we had 3 days before as a breakfast. Cannot. Everything cannot learn. So even system wise, there are classes now. 1 hour there is a class, followed by another class, followed by another class. That system is also not so good for brain assimilation. You are not giving time for children to think and assimilate that information, rearrange that information inside your brain and get it to permanent memory. That's why there is a need of tuitions for your children. They'll come morning till evening, they'll go to school, come back, evening, okay, have breakfast, have something, tea, coffee, go to tuition. No use. Because learning, if you are giving some time as a play, or some time for yoga, sometimes some mind word, something they are playing. They are playing, their mind is drawn to that particular different activity. But at the same time, you are giving a time for that particular learned thing to get assimilated and absorbed. That we are not giving. At least few of our housewives, mothers, please concentrate on this. The brain stores information by absorption, assimilation, and re-expression. Most of students, they have a problem that they'll read everything, they understand everything, every tuition will go, but during exam they'll be totally blank, done. Because re-expression is a problem. We'll work up some of the things with few students. So here what we are using, we are using 5 different types of resonating sounds. Anything from your vocal cord which makes a resonating sound. I use Amin. We have devised Amin resonance meditation technique. Because Amin is a word which is most faith in Islam practice. We do wuzu and all the practices. After that we do namaz. So that we will be using this particular Amin. This is some form of resonance, perfect phonation. We'll say that. If you don't know, Amin will say. If you don't mind. This one's Amin. With breathing, we'll try 2 techniques. Christians also. Amen. Amen. Just words. It will not make much difference. Just say it as a normal saying. Loud. 1, 2, 3. Amen. Okay. Now we'll say with the breathing. Take a deep breath. When exhaling, you divide this Amin into 3 portions, which will add up with exhalation. Like this. Take a deep breath. Absolutely will feel relaxed because it works through the physics mechanics of resonance and reverberation. Resonance seen in physics somewhere. You use tuning fork, hit it to a rubber pad, and there will be a small vertical tube. We hold it on that. So sound waves goes like that and reverberate. So any sound you can use. We'll use one like that. We use one for treatment. I use for one of the research. Take a deep breath. Exhaling. We'll use 9, the same with the closed eyes. I want you to feel how it feels. 9, something like that. Take a deep breath, close your eyes. 9. Slowly and gently open your eyes with few blinks. Okay. Where there is no acceptance, in Malaysia there is a yoga, there are few things that is not being accepted. Thinking that it's a fatwa. I'm not wrong. I don't know much information. Fatwa, there is a fatwa against yoga. So most of the Malays should not practice yoga. So this is a bold decision from Malaysian Yoga Society. What we are trying is, we are giving yoga in absolute science manner, nothing else. I am using 9 as a resonance. What is the physics? What is the principle? Physics, resonance and reverberation. Can you use 9? You can use very well. Resonance techniques. So in that way, we are modifying the basic principle. Basic principle is Omkara. They say Nadanusandana. Om use that. Okay, no problem. The science behind that, we hold on to that science behind that. We use some other words. Could you feel more or less similar effect using 1, 9, Amin? Yes, sir. That's how we should modify and change. That's a creative expression. And this is for all students. There are more than 5,000 books published every week in the world research. There are 2 world wars up till now. In the meantime of 5 to 10 years, there are 100 million people killed. Very recently, I saw one more news. Some police person called somebody near and just opened fire on 80 people killed. There is somewhere something, in spite of so much advancement in every field, it's not one field, there is something wrong, something somewhere wrong. In the past 3,000 years, there are 15,000 wars. How many wars per year? 5. There is something somewhere is wrong. Somewhere it's not one place. Every place inclusive. It's not one specific place. Afghanistan, nothing like that. But they're all inclusive. Somewhere something is wrong. Information, we not say that no information available. Say research is 5,000 books published every week. It's huge. No, it's very huge. So what exactly we are learning? What students are learning? In schools, colleges, everything? Nothing much. Because all the learning of whatever subject in most of the places is based on ambition, ego and competition. We made yoga as a competition not to show this, because people's mindset is this one, competitive word, ambition, ego-based technology. We are showing yoga in the form of competition to create an awareness. You know, what's the concept? Few of them ask, why Malaysian Yoga Society is arranging yoga competition? Yoga should not be a competition. They say that. It's because entire world is like that. It's ambition, ego-based, competition-based world. For us to touch that particular field, for those people, we need to have competition, then create awareness. This is awareness. So there should be some changes in the form of center of education should be on love, unconditional love. I am very specific in that. Unconditional love, cooperation, mutual cooperation, independence and interdependence, and based on humility. Whatever I know something, but I keep it for myself. It will go with me. I know something, I will share in a very full of humility. It will reach to more people. There are 2 ancient techniques of India which are almost dying are marma and mudras. So how many you 7 years yoga? How many mudras you know? 5. 1, 2, 3, 4, 5. What is that? 5 mudras you know. Okay, those signs are dying, mudra and marma. So that we are going to revive through Malaysian Yoga Society. Few of the techniques will be giving it in a totally traditional base.
What was the second one?
Marma. Marma is a vital point. In Tamil people they call varmam. Varmam is ancient, developed from there. Varmam. Marma. Chinese they say. I don't know. So few vital points, meridian points. All those. So there's only principle: cooperation, unconditional love, interdependence, and humility. So yoga teaches all this. That's why it's different. In spite of all opposition, it's being accepted worldwide in one or other form because of this. Because it's based on, teachings are based on unconditional love, cooperation, interdependence, humility. So that we are going to incorporate through few of the children skill development training. Story time. Can tell the story.
There were times I was really in opposite direction.
Cooperate rather than go against different way.
And country has to grow, has to cooperate. So you can use this technique in a different way. We can apply to all the people. Not very few people who are interested or something like that. Especially for you. It's the information for you. It's like I think more than 70% people are from Bhumiputras. So remaining people who are very very interested in yoga and some of these activities. Okay? These principles can be applied. So general principles can be applied. Name, change the name. Apply the principle to all the people. Can we? We can. There should be political will, individual will also. So there are 3 different types of teachers based on authority, unconditional love, and when teaching you yourself become a child and teach. That will be more effective. So on the track of love, the train of knowledge flows. Okay. So especially for students, yoga uses both brain teaching techniques, left brain activity, right brain activity. Left brain is a logical reasoning based. Why this is so? It's this one. Right brain says, okay, I accept it. Dance forms, yoga, not yoga. Dance forms, few of the instruments learning is more of right brain. Right brain people are more emotional. Left brain people are analytical, too much analytical. So segregate yourself what you are. Too much analytical, too much emotional. Try to balance these two. Try to learn both the techniques which you are deficient. There was an ancient epilepsy, fits. Epilepsy. There used to be a treatment wherein the connectivity to the both brains will be separated. See, for example, this is a brain. One portion of a brain has a epileptic signals sending from a neurons. To prevent other part of a brain to get affected, they used to cut middle portion. So what they used to feel, if they see from right eye, the picture they will see is a detailed picture. They can identify if it's a very beautiful scenery. Say for example, ocean, at the bank is a sun. They can make out all the details. There is a sun, there is a cloud, there is some bird, there is something flowing, there is one person in the corner, there is sand. They can make out the detail, but zero feeling. If they see through left eye, like this, they'll feel the scene very well, because you see both brain activities are being connected. It's a corpus callosum. It's one which tube which connects both left and right brain. Left hemisphere, right hemisphere. They'll cut that initially, before, not now. Now they will not use. So with left eye it's only feeling, no details. That's how it shows there is the existence of right brain activity, left brain activity in practice, in existence. Then it's not just a fake or something. There is a left brain activity separate, like right brain activity separate. It's not for us, not for normal people. It's epileptic people. To prevent the epilepsy, they have been cut apart middle portion of a brain, and both brains will read information differently. Same information differently. That's very fun. Youth are mainly based on impulsive, instinctive natures. So, to add up those things, we are going to add some occasional training activities, yoga games, few of the physiotherapy exercise-based games into our youth training programs. Also can be applied for corporate training. A few glimpses of emotions, different emotions which will manifest and what it means. So this one you can refer at home. There are 7 different types of intelligence. Yoga touches all this. Okay. We'll do some practice. We are try it from stand up. Keep your both hands like this. Up. Okay. You're opening your eyes and trying to touch the tip of each finger. 1. Observe the very subtle changes. 2, 3, 4, 5, 6, 7, 8, operating 9, 10. Stop. Relax. Now keep your eyes closed and do the same in front of you, like this. 1. Touch the tip of each index finger together, touching to each other with closed eyes. See the difference? See, there is some very subtle difference you notice. Very few people can notice that. What I am going to share. Very few people. There is some very subtle sensation. Stop the practice. Open your eyes. Now you do the same practice like this. Open eyes or close eyes, doesn't matter. Keep your eyes open. Better to open your eyes. Open your eyes. Stop the practice. Only 1 or 2 people can notice. Hold your thumb like this. Open your hands. Only move index finger of right hand. Only move index finger of right hand. Only move little finger of left hand. Can you? Very good. Only move ring finger of both hands. Can? Cannot? You cannot? Very specific. Please look at your finger. Very specifically you can move the finger. Now you do like this. And touch. Okay. Can you do this one? You can. Now, sequentially move the right little finger and left index finger. 1, 2, 1, 2. Right little finger, left index finger. Move sequentially. Left index finger, right little finger. Keep moving. Change the pattern. Left little finger, right index finger. Keep moving. You can slowly drop your hands down. Now, see the difference? Please move your big toe. Okay, only one toe, only toe should move. You can, it's very good. See, come here. Please come. You can move your toe very well. Come. I am just part of the team. So, just move it. See, very specifically, without moving those fingers, you can move. You come. Move your big toe. See the difference here? She is trying to move big toe because she is very conscious. She's on the stage. She's trying to move very consciously with toe, but the remaining toes are also moving. Yes. Now you move little finger of your finger. Yes, you can. Now you move the middle finger. Middle finger. Right? All of you try. Move your middle finger without moving other fingers. Finger. Sorry. Move your little middle toe. So this is yeah, you should catch down like that. Move your little toe nail, whatever you call it. Only move the small one. Only move one at a time. Can you?
One at a time.
Why?
So difficult.
Thank you. Why you cannot move? Why you cannot move? Only one toe. Why? Why so?
No practice.
No practice. Come to that point. No practice. Plus, body has a very specific intelligence that we call it as a kinesthetic intelligence. What we did in front like this. Anything you noticed? When you did this with open eye, you did this one with closed eye. Any difference you noticed? What?
It touches when I'm closing.
Closing eye in front of you touches better?
Yes.
Very good. Your observations are very good. This particular body portions, this one. Sir, from here. Body's intelligence is super. Body's intelligence, kinesthetic. Kinesthetic means motion. Body's intelligence is super. You can do with closed eyes. You can. This portion is less. Even though you kept your eyes open, there is little difficulty to touch the tip of each index. At the back, very less. The sensitivity is very less. So that's the body's its own intelligence. Tip of your fingers, you can feel the gentle touch. If I touch to your back, you will not feel. Because back sensitivity is 42 mm. Fingers is 3 mm. 3 mm discrimination you can. So that's how they say use beads to activate your nervous system in any religion. Okay, we also try to work on each intelligence. Musical intelligence, logical intelligence, linguistic intelligence, spatial again. You're moving your picture up with closed eyes, that you can make out that you can be aware that I can feel that vibration. I can feel that vibration sense that my picture is up. With closed eyes I can feel. That is spatial space, you can identify the space. Interpersonal and intrapersonal intelligence is very less touched topic. So 49% of American, you can sit down, thank you. American citizens have one or other forms of psychiatric and psychological illnesses which are not yet clinical. It's again research data. India will not talk much. For spiritual things, India is destined to be a world teacher because it has always India needs a lot many things to learn itself. Now it's in the midst of biggest turmoil where West, East and West are combined, and India is now it's a westernized population. So now it's a thing we are trying to move. I am coming out because interest towards yoga is very high. West outside interest and dedication towards yoga is tremendously high. In terms of Westerners, even following Yama, very few but follow compared to India. So Indians, it's not much acceptance is there, yoga is there everywhere, but it's not in that particular way. Acceptance is more, that's why we're coming out. So psychic abilities through yoga. So again, we're combining, interlinking all the 5 sheets. So personal, beauty, joy, love, sensitivity, peace, compassion, value. Value, very important. Character, leadership, teamwork. So these are all things which we can concentrate on each individualized or corporate or student or any individual. Memory also. visual, auditory, kinesthetic. There are 3 different types of memories which will be stored. Visual. Some of you can remember faces. Some of you can remember names. That's how it changes. Some of you can remember that particular note, musical note. Some of you can just remember that visual. So, okay, there are some visuals. Or if you say, for example, you are in a picnic, each one's individual expression will be in terms of what you have seen or what you have heard. So, one person may be saying very beautiful ambient sounds, bird chirping and all, ocean sound I heard. Another person who is mainly visual based memory input, they'll say, oh, what a fantastic nature it was, something like that. One kinesthetic, body movement. I walked through the area, I felt very nice. In that way, that's a form of memory. The yoga concentrates on all these things also. Emotions, intelligence, different intelligence, psychic abilities, memory. How you say yoga is a science or religion? Yoga is a science or religion? It's left to you to decide. It's very specific science, system of science devised by Sage Patanjali. One person devising all these things. Very difficult. Religious matters are different. You worship something is different. Totally neglect all those. Take the essence of yoga in the form of science. For everything, for all the sheets of existence, we can give it in an evidence-based science form. For you to learn and teach. Now you say, when somebody asks you, yoga teacher for 1 year, 2 years, 3 years, 7 years, what you learned, what you can give to the world is this. And you give it in an evidence-based way. Yoga, there is one research again, all the research inputs. Yoga increases gamma amino benzoic acid levels in the brain. It's a neurotransmitter, it's a good neurotransmitter. Yoga and few other techniques will increase. Specifically, they compared with yoga and other Tai Chi exercises. Yoga will increase much higher. It means that biorhythms of your body can be set normal. They say wake up early. I'm waking up at 8 o'clock. It's another thing. Wake up early because your hormones will set in a right pattern. Circadian rhythm, they call it. CIRCARDIAN. That's my teaching. Check it in the internet. Or day and night cycle. Sleep early. Sleep early because there is a level of melatonin and serotonin hormones which induces the sleep. If there is a very bright light, the melatonin secretion will be less. You cannot sleep. That's a concept used in all the call centers and BPO. There will be very bright light, but they will not let you sleep because you need to work there. Okay? So there are other new sets of patterns of diseases like shift workers sleep disorder, corporate level. Shift workers sleep disorders. It's very new. You will be prone for anxiety. You will be prone for throw things out. You will be short tempered. You will tend to have, if you are more than 40 years, you tend to have hypertension, you tend to have diabetes. It's a very set of patterns of disease, very specific for the job profile.
So even though somebody is sleeping at night, she should be down.
Yeah. Because melatonin is the hormone which responds to the light. That's why people say with the sleep disorder they take melatonin tablets. Have you heard of? They take melatonin tablets. And yoga increases deep sleep cycle. There are 2 sets of cycle, NREM and REM, random eye movement phase and non-random eye movement sleep, deep sleep stage and other variations, dream sleep state. So yoga increases deep sleep state. Proven, and give all the evidences which medical journals have published, which volume, which page number can be. So few of the benefits of yoga, endocrine function normalize and all those things to go through. So few of these diseases can apply. Some of you are yawning. Okay, we'll have a fast session and I'll of all the earnings. Later, if you still have time, you can go for fast mudra. You can take some 20 mudras with you. Come to standing position. Take it all notes and everything out. How much time I should give? You should give to me, please. Half an hour, 20 minutes? Half an hour. You can just give some 5 minutes break and go to the washroom, relax yourself, stretch yourself, come back. 5 minutes break. Medically prepared yoga person, they will concentrate more on this level. Well, see, these are different ones. Some of them say that thousands of Swamijis, they will wear saffron color and they'll sit like that. They'll know some of the chanting after them. You have heard of some Nityananda, all the Nityananda, all the sections can be seen. It's a new form of spiritual weakness which doesn't need any investment. Can physical ability can yes, body measurements, your fat. That energy very well. There is a aura reading machine.
So it only tells you your state at that point in time because it can change. So after 5 minutes can change depending on.
But if you say there is a liver meridian is lacking, it means my kidney meridians are lacking. It's not correlating, but it can be stable.
So the reading, the aura reading can tell.
Okay.
Somebody needs to know how to translate.
Or to emotional level, we can give all the answers for the emotional level. I can happiness analysis scale will tell you how peaceful you are. I have all the.
So it's true resonant, but not true reading or something in the body.
Not much. Not much devices to energy, feel the energy from us.
Because you don't have a baseline, right? The baseline knowledge.
That's why yoga is not being accepted much.
I mean, it's great if they come up with some baseline. Then at least you can know that focus on how the same ways that you can. Even in this state, just need to.
That is unnecessary. That is the research based psychology. There is no instrument which can tell you how much happy you are. How it's only set of patterns like you're happy in this situation and not happy in this situation. That only can.
As long as like you have a baseline, so this is the state.
It's all well proven. Proven. Psychology secretary said that. Based on research, based on evidence, work from so many people, more than 3,500 people, analyzed by so many researchers, the set of patterns can identify how much aggressive you are, how much, what's your first criteria, that one is our third, how many scales, okay, how many of you have back pain? Is it very severe back pain or mild? Tolerable? Can tolerate? I just better change my the muscles altogether. I can tell you which are all those. Just I want you to feel before you learn it. Both hands in front of you, legs apart. You have much space for you to work on. Both hands in front, legs like that. Stretch and bend a bit. Tai Chi also here. Tai Chi balancing your center of gravity and working. Move your hands so much so that till you feel tired. Don't bend at your elbow. Keep it straight. You can see this again vibration medicine. What I said. This technique can be used for the people who have little fat here. Keep doing. Keep doing. Stop the practice. Very slowly. Release your hands now. Feel the circulatory change. If I connect the Doppler to my hands, Doppler, there will be definite blood circulation changes. One more time. Keep your hands in front. Now you notice you cannot do this to the extent that you done it before, because there is a deposition of lactic acid and other chemicals in your muscles which will make you feel tired. Okay, keep going. No yoga, full science. Keep doing faster. Keep doing fast.
Then bending or straight?
Same.
Straight.
Same. Stop it. Feel the changes. Very slowly. Drop your hands down. Get ready mentally to undergo the same practice one more time. Hands up. There, in front of you. Make an angle of 90 degrees. Rotate. Now you keep rotating. You will feel exhausted faster. Yes or no? Because there is a subtle mitochondria which are power cells of a power bodies of a cell are getting exhausted. Nothing. Stop the practice. Drop your hands down. Okay. Any change you feel here? Yes. You feel changes here in elbow and trapezius. Where can be applied? For a computer person sitting in front of computer for long, working on hands and everything, shoulders can be applied. Both hands in front like that. You're doing this, and as if you're throwing your emotions and problems out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Stop the practice. Feel the changes. Drop it down. This is a very specific exercise to concentrate on cubital fossa. This is called as cubital fossa. So there is a dip near elbow, that's in and around your elbow, especially works on those. Both hands in front. One hand up, one hand down. You are feeling your both hands stiff, totally stiff, not loose. Like this. 1, 2, 3, 4. Keep doing. This works mainly on this particular chest muscles called as pectoralis major muscles and your deltoid. At the same time, indirect workup for your other groups of shoulder muscles. Keep doing, keep doing. Gently stop the practice. Release your hands down. Feel the changes. Okay. This same practice can be progressive exercise. If I say progressive exercise, what it means? Keep doing the same exercise in a full range of motion. I'm going for full range. 1, 2, 3. Now you can feel this chest muscles. 4, 5, shoulders. 6, 7, deltoid. 8, continue. 9, 10, 11, 12, 13, 14, 15. Stop the practice. Please drop it down. Now all the practice what we'll do it without dropping our shoulders down. Okay? Both hands on your thighs. One hand up. Hold it stiff. Very stiff. 1. You are going to swing. You are holding stiff. Continue. 2, 3. Continue. 4, 5, 6, 7, 8, 9, 10. Stop the practice, but don't drop your shoulders down. Keep your both hands like this. In front, legs apart. Logic is you are trying to touch your wrist together, at the same time trying to touch your forearms. It's like this. 1, 2, continue. 3. Trying to touch your forearm in this. 4, 5, it's painful. 6, 7, 8, continue. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Don't drop your hands down. Don't drop your hands down. Keep it down. You're going to rotate one hand. 1, 2, 3, 4, 5. Change the direction. 1, 2, 3, 4, 5. Other hand. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, 5. Both hands. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, and 5. Don't drop your hands down in front. It's a progressive strength building exercise for your shoulders and trapezius. That's why you are concentrating. Progressive because it's not much rest in between. Keep your hands like this. 1, 2, this joint, 3, 4, 5, 6, 7, 8, 9, 10. Stop the practice. Right and left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Change the direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Stop the practice. Stop the practice. Don't drop your hands down. Can you feel your shoulders? Very slowly. Drop your hands down. That's a progressive strength building exercise. Very specific, no?
You feel there's something there. It's like,
what you're feeling is trapezius muscles. Hot. You're feeling the muscles hot. Hot muscles. So, because trapezius muscles are working too long. That's why I made you do this, because these muscles are very thin sheets of muscles. Because your muscles of your back are very strong enough to hold you like that for about how many hours? 1 hour, 2 hours, 3 hours?
16 or
You
18
think?
hours.
Think this one as a ball, this one as a rod. Your muscles are holding at the back, pulling your head up, spine straight, holding for so long. How long? I am trying to explain cause of back pain. More than 60-70% of back pain. The muscles are holding, not resting. Even if your chair, if it is not ergonomically devised, chair is not giving much support for your upper shoulders, then you will end up in upper shoulder pain. Go to doctor, no use. They will give you painkillers. For 2 days, 3 days it will be alright. Again, sitting posture is not being corrected. There is not much we are working on. So it means that back muscles are very strong enough. At the same time, you need to take care of them also. It's a comparison with your shoulder muscles and back. So shoulder muscles are little weak compared to back muscles. Lift your leg like this up. Make an angle of 90 degrees with your hip joint, 90 degrees with your knee joint. Ankle movement. What you are doing is just a range of motion exercise. Up and down, 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Don't drop your legs down. Yoga comes here, Kartaka. Look at one particular point in front of you so that you can balance very well. Left and right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Change the direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very slowly drop it down. Feel the changes. If you apply all the gadgets and everything, you can notice. Left leg, what you are holding is a isometric exercise for left leg, because it's holding the weight. Muscles are working or not working? It looks it's not working, but it's actually working and holding your body weight. That's an isometric. Isometric means length of the muscles are not shortened, but muscles are working. Into one more exercise. That is, you push the wall with your one hand and feel the muscles. Can you? Push the wall straight away with one hand, feel the muscles. Feel the muscles, especially shoulders, deltoid. Can you feel muscles are tight? They are working. But length of muscles are not contracting. Muscle length is not changed. This is isometric change, isometric exercise. In physiotherapy, they'll exercise. If you go ask, headache, migraine, they'll explain this now. Rest, release, rest, release. This side, then at the back, With your hand you are pressing your head, with your head you are pressing your hands back. 1. And this. So these are all isometric exercise. What we are flexing. Flexion is an isotonic exercise. Tone. Muscles are getting shortened and tone is increasing. So difference between aerobics, gym and yoga. Aerobics mainly concentrates on cardio, respiratory and skeletal. Okay? Cardio, respiratory, skeletal means to say I can hear music and I can keep jogging. But you cannot do that same thing with here now. You are looking at one point, you are balancing. You are also working your left leg isometric, left right leg isotonic contraction. At the same time balancing exercise. See, this is all science. Yes or no? You are looking at. I cannot keep listening and I am not being aware of my body. I can just keep listening to my music. I cannot. It's a difference. It's a difference between aerobics and yoga also concentrates on nervous system. So when the balancing comes, nervous system is active. Nervous system and endocrine system. You are getting up early and facing the sun. It means that you are concentrating on circadian rhythm. How much growth hormone should be secreted? It will secrete to an optimal level when you are following that particular route. This is Sandhya Vandana in the evening, morning sun yoga. They'll segregate. They'll make sun yoga. Do this practice of seeing sun indirectly, half an hour before sunrise, half an hour before sunrise, half an hour after sunset. Because in the environment there are very less UVA, UV, other UV lights. Harmful ultraviolet lights are very less. If you see a UVA measurement device, it can measure measurement. There will be less ultraviolet, harmful ultraviolet radiations at that particular time. That's why they say also do that. Okay? I'll go ahead. I'm talking too much. Come. Catch hold underneath of your knee joint, range of motion. 1, 2, 3, slow. 4. If I look at one point, I can balance right and left. 1, 2, 3, 4, and 5. Rotation. 1, 2, 3, 4, 5. Change the direction. 1, 2, 3, 4, and 5. Stop. Radhika. 1, 2, 3, 4, 5. Right and left. 1, 2, 3, 4, 5. Rotation. 1, 2, 3, 4, 5. Change the direction. 1, 2, 3, 4, and 5. Stop the practice. Both hands in front of you. Legs apart. You have to squat down. Maintain. Maintain for a while. Slowly down. Or you can also do both legs together also if you can. So that you can squat more. Squat down. Then slowly release your hands. Feel your quadricep muscles tight. You feel at the back, not much tight. You feel that? There's a difference between these groups of muscles. At the back is a hamstring muscle. Front is a quadricep muscles. You feel your calf muscles very strong, stiff, isn't it? So working on quadriceps and calf muscles. Slowly come up. You can name any asana. What is this asana? If you do this, Utkatasana, extreme posture. You know, squat down, sit completely down, hands up totally up, don't fall back. Slowly come up. One more time. This you can use for slimming. Squat down. Yes or no? Slowly come up. One more time. Squat down, you do it. Keep doing. No, last time. Squat down. Maintain for a while. If you have knee joint pain, don't do it. Or do it halfway. Slowly come up. Very good. That's how it makes a difference. If you have knee joint pain, there are a few exercises which should be avoided. This you have. Slowly do halfway. So that's a variation. Okay? Now keep your hand on your waist. Gently hip rotation. 1, 2, 3, 4, 5. Change the direction. 1, 2, 3, 4, and 5. Both hands like this in front and sides. You have to rotate your hip joint in a big circle like this. 1, 2, 3, 4, and 5. Change the direction. 1, 2, 3, 4, and 5. Stop the practice. Come near to the wall. Now, specifically, we will concentrate on external and internal groups of muscles which are there this side. That you will be feeling. And I should not do here. I will do it down. See, okay. Like this. 1. Come up. Slowly, slowly. Make sure that you are not going to hurt or you are not going to fall. Tilt your pelvis towards the wall. Keep the hand straight. Feel the sides of your abdomen. Feel it. Feel the sides of your abdomen. Do you feel those muscles tight? That is what muscle you are holding is external oblique muscles. Inside that is internal oblique. Slowly come on. If you want to reduce that weight, or you say barrel, or you say bulk, tires. You can measure them by calculating with what's that instrument? Skin caliper. You can use calculate so this thickness at the back of your nose you can calculate. So again science. We will do it 10 counts. 1, come up. 2, come up. Internal oblique muscles. 3, come up. 4, come up. 5, come up. 10 counts. 6, come up. Tomorrow evening or morning. Tomorrow morning you remember me. 7, 8, 9, and 10. Stop the practice, change the direction. Do it 10 more counts. Continue. 1. Do it slowly. 2. With full awareness. Slowly. 3, 4, 5, 6, 7, 8, 9, and 10. Stop the practice. Come back. Same standing posture. Leaning backwards. Drop your forearm. 1. Feel. Sitting back. Relax. You feel it. Just lean backwards. Feel your abdominal muscles. You feel. Like if you have back pain, avoid this practice. Or back pain. If you have back pain, just do it very gently so that you not hurt much. So back pain people avoid acute forward bending, acute backward bending postures. This is how we can give us the therapeutic things. Two hands loose at the back. Feel your abdominal muscles trembling. Slowly come up. 1. It is not possible for you. You can do this. What is this? Asana? Down pose. Do not use complete down pose. You use half. Look backwards. Feel your abdominal muscles come back. That's all. Variation. Lean backwards. This is safe. Not wrong. Lean backwards. Feel your muscles. Feel your muscles. What you do? I will try at least one muscle before you do it. That's enough. Lean backward. Feel. Slowly come up. More time. Lean backwards. Slowly come up. Will you feel the muscles? Keep doing for 1 or 2 more counts. High nose. Slowly stop the practice. Select your partner from one. Partner you want. Come back. Select your partner. We are concentrating on these groups of muscles. If somebody is having stiffness here, I want you to feel it. Some of you come. This is scapula. This is scapula. This is scapula. Feel the muscles.
Everybody touching you.
No, this is the surface anatomy. If I say the collarbone, the collarbone. If somebody is very thin, we use them for showing the collarbone. Nothing to be scared of. If there is a thinking or something, you can correct. Also, if there is some stiffness, you can make out. Is there any pain here? No. Okay. See those muscles. 1, 2. It's a Russian sports technique. 3. Not mine. 4. Not mine. 5. So 6.
How much do you pull?
You can notice. You can feel that. 8.
Shoulders down, tightness at the back.
Inside the computer.
Okay. Slowly come out. What do you feel? Right shoulder. What do you feel? Any change? I get to use this motion. Do it on that side. You try 1 to 1. I'll do coming right. And now.
This is for the back.
I'll use yes. 4, people with a stiff back will feel more relief. Your normal athletic person will not feel much change. You do a lot of push-ups. So you do push-ups.
I used to do before I practiced. Last
Can I bend the knees if she doesn't want to be I don't know, like I have to.
Yeah, back to this
I know that
But it's like
Stop the practice. You heard of threading the needle yoga? Threading the needle. 7 years yoga. This is a needle. Hole. It's a thread. One. Same practice for back pain. You can do this. You're moving your shoulders at the same time. Back muscles are not being hurt. There are so many. Don't practice this. Just variation. Don't practice. Asana you know. Asana you know. Stretches which you don't know, you practice. Come up. Hands up. It's the Russian martial arts shoulder loosening technique. Russians are very interesting and very different, you know. Compared to American athletes, Russian athletes are very strong physically, but their bulk of muscles is less. Bulk is less, but strength is more. They concentrate specific groups of exercise therapy for that. Bulk of muscles will be less, but strength will be more. You heard of kettlebell? Kettlebell will be like this. With some weight like that. Something like that. You'll be holding with your hand and you'll be doing those exercises. One. There will be very big weight. So they use that particular techniques for strength building. They use some techniques taken from them for loosening. One. You push your one hand one side, other hand up. It looks like some dance form. Nice. One. Push other side. If this is one, it's a Virabhadrasana, warrior pose. So you just twist it. 3. Okay. 4. Could you feel the shoulder stretch? Could you feel the stretch? If you are not feeling, you can move your hand at the back and it's a little more twisted. Continue. Few more rounds. Continue on your own. Rounds on your own. Continue. Keep doing. Keep doing. Keep doing. All of us will come to the floor line. Okay. So one line. Take on the line. Correct and two line. Come. One exercise which combines all the lower leg muscles. So the accidental discovery. And you do some other exercise. No, I can't be made. So somebody almost or maybe on the food she found this day of evolution exercise. Can sit normally. Like this, can sit normally. You can now. Easy. You don't do this. So show us for you. So we will do the special. And then we have exercise, you can do this. Long support. Bending down. Very good exercise. 50 minutes. 1. 2. Yeah. Support your back body. Don't fall. Hold. Let go. You can move. See the motions on the leg. Here the goes the use isometric. So, resistance. we do is we try to sit but in a sequential. So, medial muscles. One step in front, you are going down a bit. Just very strong. Little bit. Just a bit. Something. Okay. You feel tired. Don't get up so fast. Okay. Next step further. You want up. Keep learning. Somebody. One more step. And not make you wait for long. Let this down. Done that side. And then you keep walking. On this you are going to come up. One more step in front. Come up. Maintain. Slowly come up. A bit. Feel the changes in your hand. Gently come up totally. One exercise. One side. That is if you can. Swimming. One more time. Till now you did it with instruction. Now you know it. You do it for your own. According to your own strength. See the difference. Your own strength. Step further and bend down. What are you doing? Well, enjoy. Maintain. Very serious, huh? Maintain. You want to drop your hand down? Yeah. Drop your hands. Next one more step. I am sweating more because my exercise almost is less. Next time. One more step further. Do the tremendous stretch and the entire body stretch. Sit down. Turn back. Come up, halfway up. One step further, halfway up. Maintain this for some more time. One step further, more up. Feel your muscles, tremendous pain and release, enjoyable pain. Slowly come up and stand. Stop with that. Could you feel all those muscles? At one go, all the groups of muscles, you concentrate. Select 2 groups. Then lower it first. Later you can see it. Select 1, 2 partners. Okay. Use this platform. One will be lying down. Lying down on your abdomen. You're going to sit on her like that. Lips, keep hands backward. Vajrasana. I'm going to sit on her. If not possible, you can sit side like that. Yeah. Take your hands backwards. Hold it long. Are you comfortable holding like this? Or are you comfortable holding like that? Which one you are comfortable? Both are? This one, okay. You are going to lift your shoulders up. You are going to lean backwards. Pulling her like that. Lean backwards. Pull. Can you? Yes. This is 2 asana. Vajrasana plus Bhujanga. Maintain. Breathe properly. Relax. Slowly release. 1. If you have back pain for any specific organic cause is there, avoid. It's good, but I don't know the person who is stretching how much he or she is stretching. You can try gentle. Be gentle on her. You can try. Okay. If you can sit on her, it will be very nice. Guinea pig. Don't mind. Thank you. You don't mind me sitting on you? I will be sitting on you.
It's okay.
Don't mind.
One, lift your body, upper body up. It's difficult.
Just please roll.
Okay, it's difficult. If you are very near to him, you can stretch your abdomen. It's a double stretch. For her, it's abdominal stretch. For her, it's the shoulders and abdominal stretch. Lift. More up. Maintain. Slowly release. One. Feel the stretch? Sir. Feel. For me, it's abdominal stretch. That's all. Not much. For shoulders and abdomen. Two. Try.
It also will be on your
Yeah. If you can, hold like that. I'm pulling. I can make out how much he can stretch. I'm not going beyond. I'm not going like this. Only gentle. It's a combination of exercise, Bhujanga and Vajrasana together. Try. Also, don't want. Maybe complication. If you don't want, you can go for. Be very gentle. Be very gentle. Be very gentle. Very gentle. If you feel pain, please let it out. If you feel pain, let it out.
Wow, she's good.
Her posterior flexibility is good. Spinal extension is good. Be gentle. Be gentle. Yes, very good. Lean backward. Lean backward.
stop.
Nice feeling here. Actually, I can do for you. Guess I'm just curl up.
You lean backward. Lean backward. Because this exercise we are doing it very fast, that's why we may not feel it to that extent. When we do the same exercise for about 2 to 3 minutes each, then we feel much difference. Gently stop the practice. In the same position, we are going to do abs training. After that, why she is doing this asana? Because it's a pose and counter pose. Agonist and antagonist. Gravity training. This will be better. One more thing, you can lie down and raise your legs.
Do the cobra pose.
Raise your leg up 90. Raise the leg up 90. By this you are flattening the lumbar area, which usually there will be concave. So we are going to make it flat. From here, somebody press me. Or you are going to press my hands up. One, you can straight. You feel exactly at the back of the knee. At the back of your nipple. Yes. My hands up the ankles like this. Yes.
My knee.
You can know. More weight of this goes to there, then goes to your back. Side leg. There's more movement.
It's okay.
It's okay. Then you can do it from here. If you have any pain, you can do it from here.
your lower back. Pain. Comfortable. Lower back comfortable. Or you can just keep moving the hand up and down. Up, down. Somebody there can give gentle direction. Do it up and down. Like this you do some 100 times. If you do it. So resistance change. From person. Will do perfect ab training. Can you use this? Right? Now I'll become unique. You are here. You are standing or keep like this.
Standing.
Yeah. Gentle. Not fully. This will act as leverage. So relax. 1, 2, 3. At this 10 counts. Then 1, 2, 3, 10 counts. Then rotation. 1. 1, 2. Relax. Relax. Abstain. Try this. Do it very simply. Fully. 10 counts. See the difference. Tomorrow. If you are not comfortable, someone standing on your feet, cannot. If you are not able, not comfortable, you are standing, you can hold like. One. Two. Slow one. If you have back pain, if you have back pain, right and left. Right and left. Yes. Anytime. 1, 2, 5 times. Yes. I can feel the muscles. Very good. Try to rotate. Left side. Left. Some 3 or 5 counts if you are tired now. If you are tired, you can do less counts. You can see his hand muscles coming. You can see his hand muscles coming. Okay, rotation for 2 counts. 2 counts rotations. Rotation. Stop. Relax. Relax. Rotation. 1. Yes. 2. Change the direction. 3 now. Change the direction. Change the direction. Change the. Okay. Stop. Relax. Later we can teach you all the back with somebody, some student.
I cannot take 2 big of
Don't mind doing
Still can, don't worry. Take my breath.
Come closer and you will line on it. Like another person that's it. Touching my keys. Closer. Somebody is sitting on it. Line on. 1, 2, 3, 4. Or you want more people, you can 8.
Flower pose, very nice one, very nice.
Okay, that's one is the power. Lie down. And this is after this chakrasana. Half pose. Pose is one. You're going to do it lying down. All the feet touching toes. Yeah. You can make a flower shape or lotus. Towards one side. Right side. Towards right side. All of it in towards right side. Feel your lateral abdominal muscles. Feel, if you can, one of you can just action of the hand. So that they'll feel their muscles. Could you feel your lateral abdominal muscle?
Yes.
Just to make you feel, that's all. This exercise, what you're doing is just to make you feel.
Yeah.
Okay, very gently tilt towards other side, left side. Roll over hips. Roll over hips.
Who can for kids? Yeah.
Pain. You can do two more. Yes, two more. Two more. Relax your abdomen. Like this you can practice. So when there is a group ambience. If you are alone, usually we tend to not practice. Just to create that group awareness. When group psychology simple like come very close. Come close and lifting like that. Come closer. Hold your knee. Come. You also come close. Comfortable. Okay, try to touch your sides and heels.
Okay, I'll put this together now.
Somebody say,
Wow. Take a picture.
okay. Not even but comfortable. Sit asana. Don't mind the shoulders.
Oh my God.
have to stand.
Oh, stand.
Okay.
Okay, can I go down?
Down support. See the difference between strong people. Come. Because male genetically built strong. Like somebody else will sit down. One of you strong people want you can. Come closer. Philip and mine is towards each other. Because height is same and we are comfortable. So you are going to support at the down. Philip comfortable? No? Philip comfortable? You push each towards each other. Fast. Push each other. Please. Go like this. Okay, comfortable? Now anybody can support. See, support a thin person, 3 people support you. You are not able to lift her.
Who is like this?
All the ladies here can
Malaysia.
help me. Yeah.
Also lift.
Please follow me.
No, I think we
You sit down. Sit down in Padmasana. Somebody has to lift you. You are not you.
And then you sit.
Thin one. Okay.
You want the medium one or the lighter one?
No, you can also.
Or tie.
You sit down. Yeah.
I sit down.
Padmasana. You can sit comfortably. Without opening your block. Yes. Yeah. You can sit very comfortably. And gently lift. And comfortably lift her. Carefully holding her elbow and. One minute to support, sir. 1 minute to support. 1 minute to support. 1 minute to support. Slowly release. Slowly release. Slowly release the hand. Support comfortable. Slowly release the hand. Release the hand. Release. She's comfortable. Raise your hand, sir. Maintain. Comfortable? No fear? Okay, good.
Okay, down yourself.
Can you stand now? With somebody support.
And then, you want to try to unlock everything.
Feet together. Feet together.
Just
Together.
standing.
Support, huh? No, not
Before
without
the back, the hand lock
Hold
over
it.
here.
Half lotus.
Standing lotus.
Comfortable?
Get by your
Comfortable or about the time?
Yeah.
Okay, come down.
Okay, slowly.
Come down. Don't jump, huh? Don't jump. Just only sit down. Again, they will lift you. Take you down. one exercise, all the people will stretch. Okay, close up. Make sure that you not hit the head there, be there. You also lean backwards. And one hand is going to touch one time, right? One time. Lean backwards, stretch your right hand.
Stretch your right hand. Stretch.
And pull on the right side. Okay, we will avoid leaning backward. Leaning backward. Just stretch. Pull the right hand one side. One. Release. Left. Release. Right. Release. Left. Let me continue. Release. Release. From the other side. Release. Video showers. Release. To the other side. Release. Perfectly. Release. Slowly. Stop the practice. That's enough. If you still have time, someone can do that fast learning. If you want to adapt to minor now, you still have time. Fast information on in class. This is the first and only class which was successful after how many days? After almost 20 days, after almost 16 days. Hands contain some of the 5 elements of our body, which is fire, air, sky, earth and water. Okay? Fire, sky, air, sky, earth, water. So mudras are also based on that. That's a pancha tattvas, 5 elements. In Chinese also there is 5 elements. There is 5 elements. At the same time, what I spoke just now is a mudra. I spoke in terms of receptors. Number of receptors in your hands are maximum. Second highest receptors are lips. That's why kiss is a very, very passionate, very deep. We feel, all of us, everybody. You'll not feel if somebody, somebody touches these 2 portions, you'll not feel much. Forehead, nothing. But lips, yes. Because number of receptors are highest. That makes us feel very intimate. Please come. So representation. Each one of hand represents one element in one organ. 5 different sensory organs. This one I have to refer. It's a eye. Fire in the eyes, you say. Fire, eye. Represents eye. Air represents nose. Sensory. 5 senses, sensory inputs. Middle finger represents ear. Sound. Ring finger represents skin, touch. Little finger represents mouth, rasa, taste. Most commonly practiced mudra is the Jnana Mudra. It's a knowledge mudra. Hand gesture which represents knowledge. They say there are subtle energies which are being lost from all the 9 randras, 9 openings of our body. At the same time, subtle energy levels like breathing, talking, looking, your hand, openings of your hand and feet. There will be energy. Energy in terms of what? It is nothing but electromagnetic energy, cosmic energy, aura energy. It's the same. If you believe the radio can work, you should also believe this mudra can work. If you believe your mobile phones are working without any connection, just because of the electromagnetic waves which are passing from one particular system device to other. So the same way, energy is the same. We are a bundle of electromagnetic energies compacted in a 5 different element sheet in the form of body, devised given by nature. Nature is a god, if you can believe. It's a wonderful name. Nature is a god. That's it. 5 different sheets. It's a bioelectrical energy. So you are preventing that particular energies leaking outside. That's why it says encircling. You are rewinding that, taking that energy back to you. So that's why you are enhancing that particular energy. That's why older people, some of the people, like few people, very famous people, some yoga related people, somebody you can name. Any famous personality? Iyengar. Anybody else? There is something in them that which makes them totally different. Iyengar, there are so many gymnastic people who can use props and who can do. That's why Iyengar is only famous. Because that energy, the same energy which is, he might have born with that, or he might have worked it out in his previous janmas, who knows. Again, coming to last life, existence of life, there are 880 written psychiatric cases which records and proves presence of rebirth. Research I am saying in terms of research. In Christianity they say resurrection. Resurrection, RESURCTION, resurrection. It's a rebirth. So that's the energy element in that particular person. If it is there existing, okay, but this is a way you can enhance that particular energy also. These are all mudras, very subtle. Okay. Fire and air. You're trying to touch the tips towards each other and keep other finger extended. It means that I am going to balance this air element and fire element. If you know the concept of disease in terms of these elements, so there is a more fire element, air element, more bloating of abdomen, more acidity, more burping. You can use this. Can you see the therapeutic aspects of that? You can change. If you know the basic principle, if you know how the disease can spread, you can give the therapy to people. There's no harm, no harm you giving this. It also activates few of the meridians which at the moment I am not able to correlate, like which meridian activates. Liver meridian, yes, maybe. Liver meridian number 17 and 18 will get activated with this mudra. So it's a combination wherein you are using ancient yoga from India and acupressure from China, the merging the same because your energy is the same in the background of evidence from medical science. The brain, different parts of brain, frontal lobe, parietal lobe, occipital lobe and temporal lobe, parts of brain. And this is autonomic nervous system. Involuntarily it controls every part of our system. That we said, without our knowledge, without our conscious knowledge, food will get digested automatically. Which is the protein, it will identify, it will break down the protein into amino acids, it will get absorbed. Which is the carbohydrate, it will break down the carbohydrates, it will get absorbed in the form of glucose. It will break down all the fatty molecules, it will have saponification, soap-like action with the presence of liver and pancreatic enzymes. It will make it in the form of soap. Then the enzymes will act and it will break down all the things into fatty acids and take it up. So all this internal nervous system has involuntary control of its all the structures, all the functions. So that's called as involuntary or autonomic nervous system. So this is the representation of two nerves, neurons, which how they will connect, how they will send electrical signals between two information. In some example they said, if you touch somebody, I feel a shock, something very common example is might be true because of electromagnetic energy. There is a neurons which sends signals from one particular cell body to another particular cell body through its branches called as dendrites and the main stem called as axon. Axon, dendrite, cell body, it's a neuron. That's how informations are being sent from periphery to center and center to periphery. Say for example, there is some fire, you touched it automatically. What will be your response? Fast it will be withdrawn. It's a fast neuronal reflex. Even without your brain knowing, will withdraw. It's because your spinal cord is already given signals to take your hands off from the source of impending danger. Take your hands off. So that's neuronal reflex are that fast. So signals are conducted through neurons. And this is one representation. It's not to scare me because it's not tip of your hand. There is some receptors. Say for example touch. There will be some wirings. It will go to your spinal cord. And from there will be some more wirings. It will go to your brain. So say touch. There is touch feeling. Signals are activating. Go to spinal cord. From spinal cord go to brain. So brain says what to do. So get up and come. You got up and came last time. No? The same information. Brain will say send some orders and it will follow. That is a motor. From brain to periphery motor system. From periphery to brain sensorist. Sensations will go up. It's a representation. Okay. This is called as homunculus. Homunculus. Humunculus. It means representation of your body depending on number of receptors in different parts of the body. So can you make out the thumb is biggest or hand is biggest there? Rest of the organs are small. Lips are second highest. You know? So that's how maximum number of receptors. You are representing the body depending on receptors. So indirectly it means that reflexology works, acupressure works, acupuncture works, mudra works, burma works, vital points work. Most of martial art people they use hitting vital points. Chinese they use some of the vital points. It works. Piece of dragon something he'll use somewhere. It may work. Who knows? So energy level nobody knows. It's very subtle to identify because these martial art people, especially Chinese people, and a few of the Kerala people, Kalviyapettu and Chinese people. Bruce Lee is the one who learned almost all the techniques worldwide, including Kerala's Kalviyapettu. He says, his books, he says, the person who knows martial arts should also know healing. You know, hit and kill. At the same time, you know, heal also. So they know. So that points, that subtle energy we can use this for healing. It's not for healing. So this is again sensitivity of your finger touch compared to the sensitivity of your back. So at the back maybe 42 millimeter, you may not feel the touch. If it is a gentle touch, you may not feel. But in your fingers, you can also feel. You can discriminate. There are two different touches. At the distance of 3 mm, you can also differentiate. This is a pointed touch. The other side is a pain. You can make out. So that fine. That's subtle. There will be activation of few of the specific portion of brain. This is a representation of sensory cortex and motor cortex. So this side what you are seeing is sensory cortex. This side motor. Motor means signals from brain to down. Sensory means from periphery to up. Brain is a cut portion of one side of a brain. You can see that there is the swallowing, tongue, the jaw, lips, face, eyes, throat, everything. But for area given for a thumb is largest. Representation of a thumb, it cannot be so much evident there, but representation of thumb inside the brain is largest area which is specified for any parts of our body. Compare it. Thumb is the largest, so most of us we use this thumb. You know, last time we did that raising your just now half an hour before, lifting your toe fingers, two nails. We're trying to move one each time. We are not able to because fine motor skills of our hands are much higher than fine motor skills of our feet. But with the training, you have seen somebody, one of the lady in YouTube I saw, a lady who doesn't have hands at all. She does all the activities through feet, lifting a baby, taking a baby's pan off, covering, and also caressing baby like that with her hands. So it can be practiced to the extent that your sensory motor reflexes are strong enough even at the feet. So that's a free will we have, and that is a neurosensory adaptability or nerve, what is it? It's a specific word I'm not able to get. So these are different types of receptors underneath of the skin. There is a representation. You can see different shapes. No? Alpha, beta, nerve fibers. There are marker cells, pressure, pain. There are different representation of receptors. So called, when you go back, you try to browse in internet, see what are all the different receptors in our body which senses signals. Okay. A lot more in much detail. Much detail. If you say this is the one, these are very few sensations of touch. These are deep touch feelings. These are pain fibers, alpha, beta. There are few more pain fibers, C fibers, something like that. There's so many. The receptors only, there are so many. I will not go in much detail. You try to find out. Vayu mudra. Touching the portion of index finger folded and keep your thumb on that, and the rest of the fingers extended. Beginners, they can hold for about 10 minutes to 15 minutes, and advanced people, they can hold for about 35 to 40 minutes and beyond. They say Ayurveda in ancient science says there are 51 different types of vayu, different types of air elements which can cause imbalance. Say for example, knee joint pain, they say air imbalance. Gastritis, they say air imbalance. I have a vision problem due to my work activity, air balance. So they advise this particular mudra for about 10 minutes along with other loosening practices. Vayu mudra. Vayu, air mudra. I'll not take much time, I'll go faster. Vayu. Folding your index finger. On that you are keeping your thumb like that, other fingers straight, both hands. So one advantage of mudra is you can do mudra anytime, after food, before food, while talking, watching TV, anything. So it is still effective because the receptors already we spoke gently, just touched the basic aspects of the receptors. So folding the middle finger and keeping a thumb on that, it's called as shunya. Shunya is 0 or infinity or a sky. It's used in few of the hypothyroidism conditions, few of the mind concentration techniques. Balancing left and right brain activities can be used. Surya mudra. Folding your ring finger, keeping your thumb on that. It's mainly used, Surya is a hot no? It stimulates your sympathetic nervous system. It's mainly used for weight reduction and activating your fat oxidation, increasing your appetite, reducing your weight, can be used. Surya mudra, no? Ring finger, folding, keeping thumb on that. You need to press it hard. Only one research conducted on this one and this one. One research conducted that basal metabolic rate will increase. So it also means that in increasing basal metabolic rate, you can oxidize your fat faster if you work up. Only, if you control your diet only. Surya mudra. I know I'm just touching this very superficial aspect of that. Okay, this is Prithvi mudra. Earth mudra. Tip of your ring finger, tip of your thumb, each side, other finger extended. Keep it on your knee. You can meditate or you can touch, depending on your body constitution. Now I'll send all these things to your email. Touching your little finger and tip of your thumb and extending other fingers, 3 fingers. Is Varuna. It's a water mudra. Varuna mudra. So water imbalance can be tried out. In few of the renal patients, people on dialysis, they can try this mudra. It will not be totally helpful. I'm sure that if I try this mudra, you will be totally slim. If you try this mudra, you will be totally mentally will be calm. No. It's additional add-on effective along with other medications, other yoga aspects. It's not complete. It's not changing the entire system and giving this. Nothing like that. That will not be evidence based. That will not be anything. That will be again just a cheating. If I say that, it will be cheating, nothing else. Okay, if I say this is a Jnana mudra, it increases your concentration. Yes, no doubt. At the same time, you need to do other practices also.
touching the tip of your little finger, tip of your ring finger, and the tip of your thumb, both sides, and keeping other two fingers extended, like a victory sign. Victory. It's a prana mudra. Prana mudra. It increases that aura or bioelectrical energy in and around you. They say Buddha has around 10 kilometers of aura around him. Aura energy. That electromagnetic energy was so powerful that it was around 10 kilometers radius. So that's why he is, a very huge circle of Buddhist people amongst all the places. Because so now you can make out energy levels can be so strong. So Muhammad Paygambar also, the energy levels were so strong that he could influence to the people to the extent that he can form very big followers group. It's not possible for each and everybody. It's divinely, godly gifted. That's why they say it's a God sent angel. That's true. Because no single individual can influence people to that optimal extent to so long. So there is a truth element in that. So that's again electromagnetic energy or aura, AURA around the person. Mrita Sanjeevani Mudra, you are folding your index finger, touching the tip of, folding your index finger, keeping your thumb on that, touching the tip of middle finger and ring finger, keeping the little finger off. It's mainly helpful for abdominal and constipation related problems because apana, lower energy levels. Okay. Apana Vayu Mudra. Mrita Sanjeevani is a Sanskrit name. Mrita, dead. Sanjeevani, life. It's a air. Another name for air. Mrita Sanjeevani, dead. Life. Sanjeevani is a life force. Mrita is a dead. So dead life is a air. So air is that important. Okay. Now go ahead. Most of religious people, somebody here, Jesus, you are seeing him like this. Jesus, you see him like this. And this is, most of Hindu gods will be like this. Okay. Now this is, don't worry, I am here. Abhaya, fear. What is it in English? It's a reduction of fear. It's a fearless mudra. Don't be fearful. I am here, kind of. If you do this way, boon giving. This hand, boon giving. This hand, be fearless. Boon, B-W-N. Boon. Bharat. Boon is not. Boon you don't know. B-W-N. Check it. Boon. This is thumb, little finger touching the base of thumb, ring finger touching the middle of thumb, middle finger touching the tip of thumb, index finger is straight. This actually dilates your bronchioles.
I can't do it. Cannot touch.
You can touch. If you are not able to touch, you use manually. You just touch manually. Like this. You can. You can hold. If you are not able to touch in time, you can just hold it. Only this hand I can, this hand I cannot. Okay, that's why I am showing this hand. So this can be used in asthma. When I am using nebulizer or wheezing, nebulizer, I use nebulizer, there will be bronchodilator drugs I use, cut it, make it in a vaporizer, use it. At the same time I use this also.
Is it like this?
Tip of the little finger touch the base of thumb first. Ring finger touch the middle of thumb. Middle finger touch the tip of thumb. Okay. Then the index finger free. Like this. Yeah, like that. Yeah, you should hold like this.
Left hand can, right hand can.
Mine right hand can, left hand can. Left hand difficult. Not used to.
Can mudras be used to send healing energy?
Send healing energy.
Yeah, is that, do people use mudra to send healing energy?
Parapsychological science is the one which cannot be proven.
Pardon?
Is what you ask me. I can say yes, but there is no proof for that.
Because you know why Zen Master Biryani, what he does is during the chanting, he will know his side, and then he will certain mudras, he will go from his side and then stand on there. And he keep doing that, you know.
That is
I've
there,
noticed many times.
how much they are doing, how much can be accepted, how much is the truth, nobody knows. So detoxification mudra, touch the tip of thumb to the base of ring finger and other fingers extend together. Detox mudra. I'll read it. This is fear reduction mudra. You are touching the dorsal surface of your palm to the chest and interlock your hands and stretching. This is a nerve reinforcement technique which most of the neurologists uses. Nerve reinforcement. You have seen the nerve there at the back on photograph. You have seen nerves, autonomic nervous system. It stimulates all the nervous systems, reflexes. Okay. It reduces fear, increases warmth, increases love, increases friendship. Actually, this is one.
So wherever I go, I do like that.
Yes. No, really. No, there is some visualization with that. With this, you are going to close your eyes and visualize the heart and visualize the arteries and warmthness. Red is always dangerous. No? Here you use red as a warmth and love. So then that same love and warmth spreads throughout, and I am going to make more friends. In that way, you say it. This is Kubera Mantra. Touch the tip of little finger to the pad of palm. Touch the tip of ring finger to the pad of palm. Flex, then touch the tip of thumb, tip of middle finger, tip of index finger. You can hold this mudra of wealth. Say in English, this one we use it in corporate wellness programs. This is a 3-point technique. 3-point technique. 3 point, 1, 2, 3. Hypothalamus, pituitary, and other pineal glands together. 1, 2, touch, bend, tip of on the side. Yes. All the mudras should be practiced at least 10 minutes.
This one is for what?
Mudra of wealth. Interlock your hands, keep the middle finger up, touch your both hands to your chest area. It's like dragging cosmic energy towards you, towards your heart area. Middle finger up, middle finger. Middle finger. You're holding index finger.
Oh, okay.
Only in the
Middle
finger.
It's called this Matangi Mudra. Matangi, mas mother. It's a royal rulership. It drags cosmic energy to you. This. So when you're meditating, you can adopt this. Also, you can experiment a lot of things. Rudra Mudra. Power. Fire. Power. This. Tip of index finger, tip of ring finger, touching the tip of thumb, other 2 fingers straight. During meditation you can use, it will generate more heat. It's a trust mudra. Interlock your hands like this, thumbs up, touch your heart here. Interlock, thumbs up, touch. Trust. It builds up more trust within yourself and without also. Interlock, both hands up. All the fingers, these 4 fingers touching, crossing this way. Thumb up like that. Thumb up. Trust mudra. This is Usha mudra. Usha means sunrise, early morning. Touch the middle portion of index finger and thumb with another thumb like this. Interlock, touch it. Press. you feel lazy early in the morning to get up, just use this technique. And then they say if you're lying down, you are pressing this mudra and then gently rubbing your heels to the ankle like that. You get up fast.
Sure.
Yeah.
I'm
Not like this. Totally lying down. Lying down when you feel lazy early morning to get up. And try this. Hold this mudra for a while, for about 5-10 minutes. Then gently touch your heel to the ankle, both sides like that. Usha mudra. Again we repeat. Varada mudra. Both giving mudra. Pushti mudra. Fist mudra. Whether you can do this way or you can do this way. Fist. Punch. It increases confidence. Let's say punching people, they are confident enough to punch. No. Okay, no, it's a subtle energy, it increases confidence. What is this? Madam. What is this? You should tell me. What is this? Prayer.
Muslims,
Prayer.
Typical Muslim prayer.
prayer.
What they do is initially clean up their hands, clean up all the fingernails, clean up your ears, everything, clean up your urination secretion, everything clean. Lips will be clean, totally off. And you go sit in a very sacred place. Then you try this. So this is also a form of mudra, which there is a specific name. I don't know. You can tell me. For this there is a specific name. For this specific name. For you sit down on Vajrasana. There is a Vajrasana. I don't mind you mentioning, but sitting like this. Then your hands are like that. Then you are doing something. Something you say. I used to go to masjid and say. They used to say what is Arabic songs, but I not understand it. They used to do it like this.
Peace upon you. Peace upon you.
Peace upon you. These are all gestures, mudras which are not being explained. Not being explained in the sense, not being worked out, analyzed. Not much. All these mudras also. So these are all very specific mudras. This can be cosmic energy draining mudra. Who knows? No? This all. You are going down. You are lending your all ego down to the earth. It will get neutralized. When you come up, you are getting new fresh energy, fresh cosmic energy. And who knows? It's the same way. Done. Thanks. It's last time you took photo. Nothing much. Thank you. I'm happy to hold you on for this long. I'm very happy to hold you long for this long.